My name is Heather Jenkins. I'm a physiotherapist with the Regional Stroke Team of Southeastern Ontario. What I will be presenting to you today is from your Tips and Tools manual from Section 5 entitled Mobility and Skin Care. In your manual, you will see several subtitles including Factors Affecting Mobility, Assisting with Mobility and Motor Function, Assisting with Shoulder Problems, Positioning and Transferring, Wheelchair Use, Walking and Stairs, Hand and Foot Care, and Skin Care. What we will be presenting today is some of that section, including the factors affecting mobility, guiding principles for assisting with mobility and motor function, and finally some demonstration of assisting with mobilities and transfers. The transfers we will be reviewing include bridging, movement of the upper trunk, rolling, lie to sit transition, a one-person standing stepping transfer, a two-person standing stepping transfer, and a two-person sitting pivot transfer. We will also briefly review some points to consider for wheelchair use and seating. There are many factors that can affect a stroke survivor's mobility and their ability to transfer. The first of these factors is motor loss. This refers to the side that has been affected by the stroke and the individual's ability to move each limb. Sensation. Can the stroke survivor feel their arm or leg, and do they know where it is positioned? Fatigue may also play a role. A stroke survivor may require more or less assistance at various times throughout the day because of fatigue. This may change the type of transfer you do, how much assistance you require, or how you perform the transfer. Muscle tone. Is the limb stiff and difficult to move, or is it limp and floppy? Balance. Can the stroke survivor sit on their own? Can they stand without assistance? And when they are standing, do they stand with their weight over both feet, or are they shifted to one side? Posture. Does the stroke survivor sit or stand upright, or do they push themselves over? Perception. Does the stroke survivor neglect one side of their body? Do they have visual problems affecting their vision of one side? Cognition. How alert is the stroke survivor? What is their ability to learn like? What is their attention span? Communication. Is the stroke survivor able to follow instructions? Are they able to speak to you, or do they understand what you are saying to them? Personality. Is the stroke survivor anxious or afraid of moving or falling? Are they impulsive and rush movements? Finally, there are many non-neurological physical limitations which may affect a stroke survivor's ability to move. These include previous fractures, painful joints such as an osteoarthritis, contractures, amputations, or obesity. Next, I will review some guiding principles for assisting with mobility and motor function. The goal of mobility assistance is survivor safety and comfort, quality of movement, and as high a level of independence as is possible. This is a problem-solving approach based on many individual factors. There is no set recipe for how you will complete these movements. Talk with the survivor. Encourage them to participate as much as possible. Move slowly and gently. Always use good body mechanics. Never lift the survivor, and never pull on the survivor's affected arm or under the survivor's shoulders. There are many guidelines for preparing for a transfer as well. Prepare the survivor and yourself for the transfer. Tell them in which direction the movement will occur and what you want them to do. Lower the bed so that the survivor's feet can rest on the floor. Lock the brakes on the bed if the bed has casters. Ensure that you are familiar with the chair and that you know how to operate it before you begin the transfer. Position the wheelchair at a slight angle to the bed and make sure that the brakes are applied, armrests removed, and footrests are up and swung out of the way. To position a stroke survivor in a wheelchair, remember the 90-degree rule. Hips, knees, and ankles should all be positioned at 90 degrees if possible. Remind and/or assist the survivor to reposition their hips back in the chair regularly. Ensure that the stroke survivor's trunk is aligned vertically and not allowing them to lean to one side. Use a lap tray to support the affected arm if available, or a pillow. If stroke survivor has shoulder problems, there are some things you can do to help. When the survivor is sitting, always support the affected arm. Be careful when handling this limb as it may be painful. And seek the advice of a professional if you are unsure how to handle the arm. Never pull on the limb. The stroke survivor's hand must always be considered in all positions or movements. Use foam wedges or arm supports placed on the tray to elevate the hand and reduce swelling. Encourage the survivor to use the unaffected hand to gently bend and open the fingers and to place the hand on the supporting surface. Never force the hand open. Contrary to popular belief, squeezing soft balls should be discouraged. This promotes closure of the hand and tightness of the fingers. Follow any instructions that have been given to you by a therapist. Report any changes in pain, swelling, or function of the hand to the appropriate person. Safe wheelchair use should be encouraged. The wheelchair for a stroke survivor should be appropriately measured and prescribed. Make sure that the survivor is comfortable and well positioned in the chair before leaving them. There are several tips to share with you as well for correct wheelchair use. Pay attention to whether the survivor slides forward in the chair when propelling it. Always observe the survivor's activity and ask yourself, does this look normal? And remember the too much, too soon rule. If a stroke survivor is doing too much, it may cause fatigue and further damage their ability to move. Next, we will demonstrate some techniques for bed mobility and transfers. The person who will present this to you is Mary Jo Demers. She is the physiotherapy practice leader at St. Mary's of the Lake Hospital site for Providence Continuing Care Center in Kingston. The individual portraying the stroke survivor for the purpose of this demonstration has green tape on their left arm, leg, and head. This is to emphasize the fact that this side is the weaker side.
Movement in bed. Bridging and movement of the upper trunk are often used together to help an individual move sideways or upward in bed. To prepare for bridging, encourage the stroke survivor to bend their knees. If they are unable to bend the weak leg, you may assist by gently grasping the foot or ankle and holding beneath the knee as you move and position the leg. Instruct the stroke survivor to lift their arm over their body. If unable, have them use their stronger arm to lift and position the weaker. The arm is then held in place with the stronger arm holding the elbow of the weaker arm. Ask the stroke survivor to lift their hips off the bed. If they are unable, the caregiver can place their hands on either hip to assist the lift. If help is required to support the leg during the lift, the caregiver can place their arm across the weaker leg to direct the pressure to the foot. Instruct and cue the survivor to move the hips from side to side or to push with their legs and move up in the bed. To move the upper trunk, the stroke survivor must be able to lift their head and shoulders and shift them sideways. If they are unable to do this action, the caregiver will need to assist. To assist this movement, place one knee on the bed close to the stroke survivor's side. Place your hands around the top of the shoulders. Be sure not to hold the neck. And place your arms extending across the collarbone, also known as the clavicle. To encourage the lift of the upper trunk, the caregiver uses their body in a rocking motion, moving backwards as they ask the stroke survivor to lift their head and shoulders. It is important for the health of your back to use the momentum from the rocking action to lift the upper trunk rather than lifting solely with your arms. Once the upper body has been lifted, it can be shifted towards the caregiver. When helping with this task, always position yourself on the side you wish to move the stroke survivor. It is easier to move them toward you rather than away from you. If the stroke survivor has difficulty lifting their head, the caregiver can grasp both the pillow and the shoulders for the lift. Rolling onto the unaffected side. To roll onto the unaffected side, encourage the stroke survivor to bend their knees. If assistance is required, gently grasp the weaker foot or ankle and underneath the knee as you move and position the leg. Once the knee is bent, the stroke survivor may rush the movement and roll before ensuring proper positioning of the weaker arm. Often, the stroke survivor may forget the position of the arm altogether, causing it to be left behind, getting caught behind their back. This can cause considerable discomfort to the stroke survivor and should be avoided. Instruct the stroke survivor to lift their arm over their body. If unable, have them use their stronger arm to lift and position the weaker. The arm is then held in place with the stronger arm holding the elbow of the weaker arm. To complete the roll, instruct the stroke survivor to lift and turn their head to look in the direction of the roll. A closer look reveals the lift and turn of the stroke survivor's head to assist the roll. If they are unable to complete the roll, the caregiver can place their hands on the stroke survivor's shoulder and knees to gently pull them over onto their side. Moving from the lying to sitting position. From the lying position, assist the stroke survivor to roll onto their side. Follow instructions previously provided. Once on their side, encourage the stroke survivor to draw their knees towards their chest. If they are unable, the caregiver can grasp around the knees and gently pull them up. The legs are then slowly lowered over the edge of the bed, and the stroke survivor is asked to push up with their arms into the sitting position. If the stroke survivor does not have the strength to complete the lift themselves, the caregiver should place one hand underneath the shoulder and the other hand on the stroke survivor's pelvis. Then the caregiver uses a side rocking motion, pulling up at the shoulder and downward on the pelvis to bring the stroke survivor into a sitting position. It is important that you do not release your hold on the stroke survivor in case they push too far over or experience lightheadedness or dizziness that can cause them to fall over. One person assists standing stepping transfer. Lower the bed so that the survivor's feet can rest on the floor. Lock the brakes on the bed if the bed has casters. Ensure you are familiar with the chair and know how to prepare it before beginning the transfer. Position the wheelchair parallel to the bed and make sure that the brakes are applied and footrests are up and swung out of the way. Assist the survivor to bring their hips closer to the edge of the support surface by helping the person shift their weight to one hip and moving the opposite hip forward. Repeat with the other hip and continue until the survivor is well positioned at the front edge of the surface. The feet are then positioned 8 to 10 centimeters apart, aligned with the hip and knees. Rule of thumb is to place the ball of the foot underneath the knee. Position yourself as close to the survivor as possible with your knees in front of their affected knee. Never place your knees around the stroke survivor's knees. This will not provide the necessary support and will cause discomfort. Place your hands around the stroke survivor's upper back. Never grab the patient's neck. The Tips and Tools binder also demonstrates a method in which you grasp the shoulder blades of the stroke survivor. This is an alternate technique. Avoid holding onto clothing or pulling on the affected arm. Do not lift the survivor by placing your hands under their arms. Ask the stroke survivor to bend forward at the hips and bring the shoulders forward over their feet. To provide room for the stroke survivor to bend forward, the caregiver must move backwards. Do not rock back and forth. Shift the survivor gently forwards and ask them to stand. Encourage the stroke survivor to keep their weight equally distributed over both legs. Position your feet on either side of the survivor's affected foot. Assist the survivor to transfer weight to one leg and assist the unweighted leg to step. To assist the weight shift, it is important to move together in the same direction. Continue stepping until the person is positioned directly in front of the wheelchair. Assist the survivor to bend forward and to place buttocks down and back on the new surface. Reposition the survivor so they are comfortable. The general rule for sitting is 90 degrees. 90 degrees at the hip, knee, and ankle. Two-person assist standing stepping transfer. This transfer is for the survivor who bears weight through the legs but is heavy or unreliable. The technique requires two caregivers. This too is a problem-solving approach based on individual factors. There is no set recipe. Be sure to communicate clearly with each other as well as the stroke survivor to ensure a coordinated effort. Prepare the survivor, yourself, and the second caregiver for the transfer. Tell in which direction the movement will occur. Position the wheelchair at a slight angle and make sure that the brakes are applied. Assist the survivor to bring their hips closer to the edge of the support surface by helping the person shift their weight to one hip and moving the opposite hip forward. Repeat with the other hip and continue until the survivor is well positioned at the front edge of the surface. The feet should be positioned flat on the floor, aligned with the hips and knees, and with the feet under the knees. The rear caregiver is behind the survivor with one knee on the bed and supporting the survivor at hip level. The front caregiver positions themselves as close to the survivor as possible with their knees in front of the affected knee. Never grab around the knee, as this can cause pain and discomfort and does not provide the support required. Place your hands around the stroke survivor's upper back or their pelvis. Avoid holding onto clothing or pulling on the affected arm. Do not lift the survivor by placing your hands under their arms. Ask the stroke survivor to place their hand around your low back and encourage them to bend forward at the hips and bring their shoulders forward over their feet. To provide the room for the stroke survivor to bend forward, the caregiver must move backward in a single rocking motion. Shift the survivor gently forwards and guide them into standing. Encourage the stroke survivor to keep their weight equally distributed over both feet. Position your feet on either side of the survivor's affected foot. Assist the survivor to transfer weight to one leg and assist the unweighted leg to step. Continue stepping until the person is positioned directly in front of the chair. Assist the survivor to bend forward and place buttocks down and back on the new surface. Reposition the survivor so that they are comfortable. Replace the footrests and the armrests on the wheelchair and position the hand on a lap tray or pillow. Two-person assist sitting pivot transfer. This transfer is for the survivor who does not fully bear weight through the legs and/or is heavy or unreliable. The technique requires two caregivers. This transfer occurs in several steps towards the new surface, not one large motion. This is a problem-solving approach based on individual factors. There is no set recipe. Be sure to communicate clearly with each other as well as the stroke survivor to ensure a coordinated effort. Prepare the survivor, yourself, and the second caregiver for the transfer. Tell them in which direction the movement will occur. Lower the bed so that the survivor's feet can rest on the floor. Lock the brakes off the bed. Ensure you are familiar with the chair and know how to operate it before beginning the transfer. Position the wheelchair at a slight angle and make sure that the brakes are applied, armrests removed, and footrests are up and swung out of the way. Assist the survivor to bring their hips closer to the edge of the support surface by helping the person shift their weight to one hip and moving the opposite hip forward. Repeat with the other hip and continue until the survivor is well positioned at the front edge of the surface. The feet should be positioned flat on the floor, 6 to 10 centimeters apart, aligned with the hips and knees, with the feet tucked under the knees. The rear caregiver is behind the survivor with one knee on the bed and supporting the survivor at hip level. The front caregiver positions themselves as close to the survivor as possible with their knees in front of the affected knee. Place your hands around the stroke survivor's upper back or their pelvis. Avoid holding onto clothing or pulling on the affected arm. Do not lift the survivor by placing your hands under their arms. Ask the stroke survivor to bend forward at the hips and bring their shoulders forward over their feet. Bend your knees and keep your back in normal alignment as you ask the survivor to lift their hips off the surface. Do not rock the person back and forth. Shift the survivor gently forwards and guide them onto their feet, but not into a full standing position. Assist the survivor to pivot and shift their hips sideways and have them sit again. Repeat this procedure until the survivor's hips are in the chair. Reposition the feet each time you have the person move. Reposition the survivor so they are comfortable. Replace the footrests and armrests on the wheelchair.
For additional information on the topics covered in this video, contact your local stroke strategy. Links to these resources and this video can be found on the Stroke Strategy of Southeastern Ontario website.